Hi, my name is Karen Mendelsberg, and today I'm going to talk about improving handoff communication between hospital staff. So, a little bit of an overview. We're going to do a little introduction, talk about reasons for problems with handoff communication, solutions, and then we'll conclude from there. So, just a little bit of an introduction. Handoff communication simply means 30 minutes between shift changes where critical information is passed from one caregiver to another. Communication is actually the basis for excellent quality of care. The plan of care needs to be well communicated to prevent errors, prevent wrong site surgeries, patient deaths, and overall to protect the patient's safety. So, a shocking statistic is that 80% of serious medical errors have to do with lack of communication between caregivers, which is pretty scary. So, these miscommunication issues, they cause patient harm, they can delay treatment, cause incorrect medication given, or even increase a patient's hospital stay. Now we're going to talk about 4 reasons for these problems. There are more, but we're just going to focus on these 4. Reason number 1 is that handoffs may be incomplete or missing information. This is a time when mistakes are most frequent. And our second reason is that too many people are caring for one patient. Healthcare today is so specialized that there isn't enough communication between one another. And our third reason is that poor teamwork can also cause missing information. An example is one hospital, they used sign-out sheets and it was to better communication between physicians. However, 67% of these sign-out sheets had errors. So it doesn't really prove to show how effective these sign-out sheets are when there's many errors. And our fourth and final reason is that in healthcare, each provider has a different type of handoff. This isn't because the providers want to be difficult and, cause problems. They just believe that their handoff is the most effective. So this makes it harder to get everybody on the same page. Now let's talk about some solutions. Our first solution is about the Joint Commission. They created a handoff tool called the Targeted Solutions Tool. Now this tool is a step-by-step process that first measures the organization's actual performance. It identifies barriers to achieve better performance, and then it directs them to proven solutions customized to their particular barriers. Now the results showed readmissions were decreased by 50% for one hospital. In another hospital, decreased the amount of time it took to get a patient from the emergency room to the inpatient floor by 33%, which is awesome. Our second solution is that a redesigned shift report was created. Now it would take about 5 minutes and done bedside. So it's face-to-face, and both oncoming and offgoing nurses are present, and the patient is also told a half hour before the shift change, so if they have any questions, they can address their questions and concerns at that time too. This showed a smoother transition, and it was so successful that it was adopted into this organization's other 5 hospitals. Our third and final solution is the use of electronic health records. This is where nurses can create a document by taking previous data from one place to another and add their own notes about the patient. So relevant information is selected and then turned into a report sheet. This improves communication, it increases efficiency and accountability, and it assures data is being completed and important information simply isn't left out. So, to conclude, problems with handoff communication results in the patient being in danger. And most importantly, teamwork needs to be improved for helping the patient have a safer hospital stay. So just a little bit of food for thought. Do you think that a communication tool could be created similar to the electronic health records, and it would be universally throughout all hospital systems? Do you think it would be possible? Would it be effective? Or is it too much of a monopoly? So I hope you enjoyed this discussion about improving handoff communication between hospital staff. Thank you for listening.